If you're dealing with gut, thyroid, or autoimmune issues, you know how overwhelming it can feel. Today I want to share with you how I helped one of my patients resolve her autoimmune hepatitis in just a few short months using a natural functional medicine approach. And if you find this information helpful, please like and subscribe so more people can see this video. My name is Dr. Thomas Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of the FreeDiet. And one of my favorite patient success stories over the last almost 40 years of practice is a 75-year-old woman who came in with autoimmune hepatitis. She had been told there was no known cause and no cure, and that she would have to be on prednisone and Imuran, a steroid and immunosuppressive drug, for the rest of her life. At best, it would keep her in remission, and if not, they would put her on the list for a liver transplant. So she came in feeling really depressed, fatigued, bloated. She gained 17 pounds from being on the medication, also had digestive issues of gas, multiple bowel movements a day, diverticulosis. She had tried to reduce the amount of prednisone with her doctor's help, and just going down 5 milligrams a month over 2 months, her liver enzymes shot right back up. So she came to me because she wanted help in managing the symptoms from the side effects from the medication. So I said, well, do you want to get better and be able to get off the medication? She said, well, yeah, but they said that's not possible. So I said, well, I've helped a lot of patients with autoimmune issues get better, so I'm sure I could figure this out and help you get this cleared up. So the first step is finding the underlying root causes. And typically with autoimmune or other chronic health conditions, they fall into 5 main categories of deficiencies, toxins, food reactions, infections, and a hormonal imbalance. And in her case, she had a vitamin D deficiency. Under toxins, I typically see positive heavy metals, environmental toxins, mold toxins. In her case, she was prescribed statin drugs 6 months prior, and that's when they noticed her high liver enzymes. So they discontinued the statin drug, but her liver enzymes continued to climb over the following 8 months. That's when she was diagnosed with autoimmune hepatitis and prescribed the prednisone and Imuran. Under food reactions, she was positive for gluten sensitivity and other food sensitivities. Infections, she had candida yeast overgrowth in her gut. And hormonal imbalance, she had hypothyroidism, Hashimoto's autoimmune hypothyroidism. And I commonly see gluten sensitivity and candida yeast overgrowth being underlying root causes for Hashimoto's and other autoimmune conditions. So I put her on an anti-inflammatory diet and the proper supplements, which I'll go over shortly. She also got approval from her doctor to stop her 2 medications because she wanted to try this natural approach. So the result was, after 3 months, her liver enzymes were normal. She had lost most of the 17 pounds she had gained on the drugs. Her gut symptoms were better, more energy, no longer bloated, and feeling really good, like she had a new lease on life. At 4 months, her doctor checked an autoimmune hepatitis smooth muscle antibody, which had been positive, was now negative. And they continued to check her liver enzymes. It was normal the following year. The year after that, she sent me test results actually for the next 5 years, and still normal values. Also, her high ferritin, which was due to inflammation and liver dysfunction, went from 212 down to 50, which is optimal. So this wasn't just remission. This, at 5 years later, still had no signs of autoimmune hepatitis without medication. And I'll let you hear a quick video directly from her almost 15 years ago. Then I'll go over the diet and supplements in more detail with you.
In August of 2010, I was diagnosed with a condition called autoimmune hepatitis, and I was under the care of physicians in Connecticut, and I was receiving 2 very strong medications, prednisone and Imuran, and not liking either one of them. My husband and I winter in Florida, so we came down in November, as we always do, and I decided that I wanted to come down and see Dr. Rofrano merely to get an opinion, whatever, from him. That's all I expected, some consolation, maybe some help with the strong side effects these medications were having on me, but I got much more than I expected, because he told me that he had had experience with treating autoimmune hepatitis and had great success, and I never expected that. And the first things that we did was, with the approval of the doctors up north, I went off those 2 medications. I told them that I wanted to try some natural things, and my doctor said fine, and I did that, and he did some testing and found that I had an intolerance to gluten. So he made some dietary changes for me, a gluten-free diet and a yeast-free diet, and he added some supplements, and I went on that regime probably in January, and here I am, it's April. I had gained 17 pounds, 16 pounds on those other drugs. I've lost all of that. I think today I've lost a total of 16 pounds. I feel and look so much better, but the really good news is that my liver tests have gone back to normal. I feel like I have a new lease on life for two reasons. Number one, I never expected that he would be able to treat me for this disease. I had been told that these two drugs that were prescribed for me, that there was no cure for this autoimmune hepatitis, that it would go into remission, that these are drugs that I would have to be on for the rest of my life, one or the other, and I might go into remission and I might be able to go off of them for a while, but chances are that I would always have to take them. And I was really, really depressed about that because my quality of life had gone downhill from August 1st, from when I started taking them, until December when I stopped. And I wasn't looking forward to spending the rest of my life on those medications. And I have a new lease on life. I really do.
So how we accomplished that was with a diet I call the FreeDiet. It's a diet I came up with years ago when I was figuring out how to heal my own autoimmune Hashimoto's thyroid and rheumatoid condition. It's a diet that's free of not only gluten, but gluten, grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, and processed foods. All those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. So with that, I was able to heal my autoimmune conditions, IBS, skin, and other health issues. If you'd like us to send you the FreeDiet Phase 1 food chart, I'll put a link at the end of this video, and also a video that goes into the FreeDiet in more detail, and the proper supplements included, what I call the Functional 5, which is multi-fish oil, vitamin D with K, magnesium, probiotic, liver support supplement, which includes milk thistle, NAC, alpha-lipoic acid, and selenium, CoQ10, vitamin C, yeast defeat for additional gut support, and I typically recommend curcumin for inflammation and immune support. So I was thrilled to be able to help my mother's sister at 75 years old regain vibrant health so she could enjoy her life again. And if you're suffering from autoimmune, gut, or other chronic health conditions, remember that it's so important to get the proper testing first, because if you find out the root causes and are provided the right solutions, I believe almost anyone can get better. Thanks for joining me today. I'll put a video that goes into the FreeDiet in more detail here, the FreeDiet Phase 1 food chart below. Please like and subscribe so more people can see this video, and I'll see you next time.